So this is episode 7 of two holistic psychiatrists talking. And the last episode we talked about mold toxicity in terms of symptoms and associated diagnoses. And today we're going to talk about evaluation of people and of their homes, and then treatment and remediation. So we're packing in what was going to be 2 episodes into one, and then we hope the next one will be a Q&A about mold toxicity and about whatever people are interested in. But do you want to talk a little bit about how we test for mold toxicity in patients that we see and suspect that's what's going on?
Yeah. Well, when I suspect that a patient has mold toxicity, which is the vast majority of the patients who contact me, I order a urine mycotoxin test. And I typically order from Great Plains Laboratory, but there's also a lab test from Real Time.
I've had people ask me when we get the result, they'll say, well, is that a bad result? As if it's exact measure of how much is in their body.
Right, it's a very complicated test to evaluate in terms of the meaning of the results. For some people, they'll have a low amount of toxin, but then after they initiate treatment, their level of toxins go up. But the thought is that then it means that they're more actively able to mobilize the toxins and metabolize them. And so therefore their test looks worse, but actually they're in the midst of healing.
Right. So things will kind of go up and then start to go down. Mm-hmm.
Kids sometimes are very effective excretors of the mycotoxins,
Mm-hmm.
and they'll have higher values.
Right. Right. We should say, and I don't know how many Great Plains is testing for now. Real Time will check for 4 specific toxins, and their technology is a little bit different. And Great Plains, gosh, I don't know right off how many they're testing for.
More
But
than that.
there's this isn't just black mold Stachybotrys, which people think about when they think about mold toxicity. Mold toxins from Aspergillus, Fusarium, Chitonium, these other molds are considered toxic. Right, are considered toxic as well and have impact on the body.
And there's some thought that the 2 tests are more specific for certain toxins, so that Great Plains will pick up ochratoxin more readily and Real Time will pick up gliotoxin. So it's not like
Right.
monolithic in terms of interpreting these test results.
Right, exactly. And then I know for me on the Great Plains test, if ochratoxin is showing up, but it's not necessarily very high, if there's a couple that are associated with it showing up, then that sort of gives it more credence, the citrinin and mycophenolic acid. So there's a lot of those nuances that I think we've just learned over time and with our collective experience with other mold and environmental practitioners.
Right.
So when someone has a positive result, I think we can talk about how to help them evaluate their current environment, even though they could have gotten it in a former environment. And they could have gotten it when they were very young. They could have colonized, which we talked about in our last video, where the mold is on board and making toxins.
Right.
So it's not always that they're getting it in their current environment, but that's commonly is because that's where they're getting worse and then coming to see us.
Right.
So,
well, I mean, some of the way to sort that out is like, I'll ask my patients, like, do you feel better when you go on vacation and you get away from your house? Does your house seem to be making you sick? And I mean, some person might say, well, like I'm on vacation, but people can tell if there's some way that they aren't sleeping well, or that they feel brain fogged or more depressed or anxious when they're in their house, and somehow when they get outside, spend a lot of time outside or in another environment entirely, that that's a tip off that there's something going on in their environment. Also, if they have like a big response to getting an air filter, like if that makes a big difference for them.
Mm-hmm. And I guess theoretically, if they're colonized, leaving the environment wouldn't make a difference because they're still actively producing mold toxins, but they still could be reacting.
They could be worse, like they may have some colonization, but the acute exposure in their environment is like tipping them over the edge.
Mm-hmm. What kind of testing do you recommend as people are trying to evaluate their home?
Right.
And it doesn't have to be their home. It could be their workplace or their school, and that's where it gets tricky because we can't always we can't necessarily go in and test property that's not ours.
Right.
Even if people are renting, they can't necessarily test.
Right. And it's not uncommon for school buildings to be old, and that the kids are getting exposed in their classrooms. But there's not that much you can do about that.
Other than take the children out of school. I mean, which some people will do if their child is becoming sick. And
there's an Institute of Building Biology in Santa Fe that trains people, and I often recommend to my patients that they contact a particular person who's living locally to where I am, and my patients have really liked her, and she comes out and she does an inspection of the home, and we'll let them know like if there's a problem or where there's a problem. And I have quite a bit of confidence and faith in her. But I think that you use ERMI testing for some patients, don't you?
Had people who had completely clean air samples and went back and did the surface testing that they had high levels of mold.
The ERMI, right?
So that's the ERMI. Mm-hmm. When I'd have people go back and check and they had surface testing and it was there, I would still have them contact the local consultant because he's very responsive, and then he would help them. And he and I talked about if there's an obvious source where the mold is, then have him come in. If there's not an obvious source, have the families do surface testing. And then if it's found, then he comes in and looks for it.
What's the procedure of doing the surface testing?
They have two tests. One's a vacuum surface test and one's a cloth. So if you have carpet, they would recommend using the vacuum. If it's primarily, hard floors, then you would use the surface. And you just go around with the cloth and take multiple samples from different places and send it in. That they provide. And then the result is pretty quick. It's usually within a week. So it's not necessarily saying like nobody should live in this environment, but it's speaking to people that have symptoms of inflammation due to mold toxicity.
Right.
So, and that could be a little bit of the difference too between air sampling. What's good air sampling for one person may not be for someone else.
Right. I mean, I don't know if it's because of Mike Schrantz's work, but I've definitely gotten the impression that air sampling often doesn't pick up the mold that's there.
Right. There's a nice video with him, or it's an interview by Chris Kresser is interviewing him. And I usually share that link. Apparently some of the spores are heavier, so I don't know if that is why the air sampling isn't capturing it.
Maybe certain spores are airborne and certain spores, like you said, are heavier, so that you find them in the dust and you get a best result if you test both. Who knows?
Right. So I'm just trying to think. So we see people, we test them, we tell them to test their environment and explain to them that without if they're continuously exposed, it's going to be hard for them to move past this,
Right.
even with treatment. As long
Right.
as they have it coming in, we
Right.
can only do so much to be getting it out.
Right. First step is to try to address that.
And I find that, um, I think there can be a level of denial, and having gone through this personally.
Right.
Um,
There's disagreement about how draconian one needs to be in terms of getting rid of things that
right.
might have been exposed to mold. And I mean, I would say do things in phases, like don't get rid of everything just right off the bat. You know,
Mhm.
if you do a total remediation, you're still not feeling well, then, maybe it is in the furniture or the books or whatever.
Right. Yeah, so when it comes to remediation, there's remediation of the environment, but then also the contents. And mold growth, let's say it's behind a wall, that has to be contained and removed in a way that's not exposing people more to it.
I've had patients that have tried to deal with like obvious mold themselves,
Hmm.
and they've gotten themselves so sick, like much
Oh, right.
by trying to tackle that, like somehow disturbing the mold then made it all the more active and virulent. And
Right. Trying to bleach it and use all these
I don't
things that
want to do
just,
that. Like there's nightmare stories related to.
right, right. And that's where if people have a consultant involved, they will direct the remediation team, or that's been my experience.
Yeah.
And they'll do testing before the remediation team does all their work, and then they'll retest. The tricky part is things like mattresses and beds. Seemingly the spores are pulled in from negative pressure, and those aren't as easily cleaned. I know we went ahead and got rid of things like that. But the approach I take with patients is to give them all the information and resources, and then have them decide what makes sense to them,
Mhm.
because
It can be very overwhelming, and it can be extremely expensive.
right.
Like if it's in the walls or if it's in their air conditioning system, it can be quite a huge project to deal with it. I had to remediate my basement because of a flood, and it was quite costly. And then subsequently, I had I installed like a very powerful, large air filter and dehumidifier.
Hmm.
That now keeps the basement really in good shape.
Right. Right. So there's one, it's taking care of the issue, but the other is to
Maintaining.
have some, right. And I think they say if the humidity is above 55, 56 persistently, that there will be mold growth. So it doesn't take much. On Amazon, they have little $8 hygrometers where you can check your humidity levels.
I see.
And my office is on the second floor, but it gets humid where I work. And so we have a dehumidifier up there, but most basements probably need a dehumidifier, but it's not hard to check. Um, so. So what about treatment for people? We're kind of talking about treating the environment, or we're giving a broad overview.
Right. Well, I mean, the first step for my patients is to use binders, and the binders are substances that help attach to the mold toxins and help excrete them out of the body. And there's a number of different binders that can be used, and there's some thought that specific mycotoxins are more better bound by specific binders. So the ochratoxin, which is one of the most common toxins that we find, is best bound by a cholesterol lowering drug called cholestyramine.
Mhm.
And you have to be very cautious with the binders, because for some people, if you mobilize them too quickly, it can cause a person to feel more ill. I've heard it described like the binders are like a magnet and the toxins are like metal filings. If you remember those toys that we had when we were
Right.
with like having like a face, and you can sort of move the metal shavings with a wand, and then there's like some that are left behind. That's how I think about it with the mycotoxins and pulling them out of the body. So, I mean, there's that prescription cholestyramine, but I also very commonly use charcoal and clay, and I use a fiber called Pectosol C. There's a lot of different chlorella, yep. And in Saccharomyces boulardii is not a binder, but it's used to treat gliotoxin. It's like it's a probiotic, another yeast.
Right.
I'll say to patients that it's optimal if they can do them twice a day, but that's often hard for people to manage because you need to take the binders away from supplements. I think that it's likely that patients who are affected by mold toxins are in general more affected by toxicity, and our environment is so toxic in general from all of the chemicals and pesticides and plastics that the binders, I think, are functioning not only to remove the mycotoxins, but other toxins as well. And often patients just feel like lots better when they're taking binders. And I mean, can also feel worse, because if they're doing it too quickly. And I mean, you have a lot of experience, Courtney, with like using minuscule amounts of binders, right?
Right. And I mean, I've repeatedly had the conversation of going slow and holding if symptoms come up, and then resuming at the previously tolerated dose, that there's quite a range. Some people are using can tolerate tiny amounts, and then there's a cap. So I have that conversation over again because everyone feels more is better is faster. That's all our approach. But I tend to do once a day binders and do them all at once. And I guess it's worth saying too that some people might wonder, well, if you're out of the environment long enough, do you still need the binders? And
I mean, one can retest, and when there's no more mycotoxins showing up on the testing and the person is no longer symptomatic, arguably they could stop taking binders then. I feel like I take binders, and I feel like I'm going to take them for the rest of my life because I just feel better on them. And as I said, I think there's just so many other toxins that they're also addressing.
Right.
What's your perspective on it?
The thinking used to be that, and then it still is the thinking, that there's 25% of people that are susceptible and that they don't mount an immune response. So then they're not going to easily get the toxins out of their body. The toxins will just get reabsorbed from the GI tract as they're put into the GI tract with the bile salts. So, so my feeling is they don't tend to go anywhere for some people, but for being interrupted with binders and drawn out of the body.
So once a person has been on binders for 6 to 8 weeks, then we move on to the next phase of treatment.
Right, unless they have a somewhat dramatic response, and then we might think they don't need the next phase of treatment, but I don't find that to generally be the case. I'll see people improving, but I don't see that many people with complete turnaround.
Yeah. And so what do you do then next? What's your next move?
Most of the people that have mold toxicity tend to have yeast overgrowth in the GI tract. So I'll often be using nystatin and then something to break down biofilms called Interface Plus. I may or may not use Argentin 23, which is in the colloidal silver family. Interventions that would address more specifically mold, and that might be amphotericin B. I generally expect that if I'm using antifungals, I'm going to be treating the GI tract and the sinuses. More often than not, I'm starting with the GI tract.
Yeah, me
How
too.
about you?
Yeah, same. Although, I mean, some people are clearly the sinuses are the bigger issue, but mostly I start
Mhm.
with the GI tract.
Statin and amphotericin B are not systemic, so they would go into the GI tract, but not necessarily be absorbed into the bloodstream in the way systemic antifungals would. So sometimes we'll use itraconazole and diflucan, which would be more specific to yeast. Even that and all these steps that we're talking about, they all require, gradual steps and making sure that so much mold or yeast isn't dying, that there's so much toxins the person can't manage.
Right.
But hopefully, with them being on the binders, that's not an issue. And in
Right.
fact, that's kind of a red flag. Start someone on nystatin for yeast overgrowth and they really can't handle it. It makes me highly suspect mold is going on, that they're
Yeah.
dealing with mold toxicity.
Yeah.
And in fact, I think a lot of the whole candida and yeast community out there online, I can't help but wonder how many of those people actually have mold toxicity that
Yeah.
they're just unaware of because they'll be just dealing with it for years.
Right.
And and specific dietary interventions are about the same.
Yeah.
Sugar will feed yeast and mold, and
So lower carb is often recommended. It's helpful. Although, there's always this discussion about, should I avoid moldy food? And that doesn't seem to be that impactful for a lot of people. Like some people, they do respond to, food that is fermented. But that seems more like a histamine issue rather than the mold itself. The mold is more like inhalation, that's where it's coming from.
right. And if I agree. I mean, when people are reacting to those foods, I suspect it's related to they have too much histamine on board from mast cell activation.
Yeah.
And
Yeah.
but I don't think it's necessarily the mold in the food.
No.
Um, there can be a lot of other food related issues though. I think mold will make oxalates go up. So again, there's a lot of people that will have high oxalates and they can tweak their diet some to bring those down,
Yeah.
gently tweak their diet, not do that all at once either.
Hmm.
But I always emphasize to people the sugar and the carb piece, like get rid of sugar and lower the carbs. That really a diet primarily of animal protein and vegetables is optimal if they can do that.
Right. It's
Um,
hard, but
mhm.
that's what's optimal.
Yeah. And two, we should say this course of treatment is a process.
Hmm. A long
Um,
process. It's a marathon. It's not a sprint.
right. That being said, it is one of those things where we see people, just steadily improve and regain their lives. And
Right. And, people who, as we talked about before, have run from one doctor to another, nobody can figure out what's going on. And it ends up that when they treat mold, they really feel better.